All right, it's now 7:13. If you're like many families right now, you're probably dealing with a virus like RSV. Doctors say it's a perfect storm of viruses this fall, with many of them overlapping in a way that they haven't before.
Boston 25 News reporter Lisa Pappas explains why it's so bad. And with local ER's beds full, how families can really tell when it's absolutely necessary that you do need to see the doctor.
At night, the jungle is full of noises.
Melissa Levin is a mother of 3 in Westwood, battling all the colds and viruses this time of year, especially now that her 7-month-old Aiden started daycare.
Socialization and childcare is really key for us. As dual working parents, we need to have childcare, and so daycare made the most sense. But then we also know that there's high exposure.
She says Aiden has already been exposed to RSV, and he now has a double ear infection.
It's definitely a major concern, especially if you have a young baby, because RSV, it can morph really quickly. It could seem like mild symptoms, and then all of a sudden, you're going into respiratory distress.
Dr. Mark Blumenthal is the interim chair of pediatrics at Newton Wellesley Hospital. He says RSV cases are soaring among children.
We expect this year to be a pretty busy year for viruses.
Boston Children's Hospital also started postponing elective surgeries earlier this month, warning families about significant wait times for hospital beds because of illnesses like RSV well before the typical flu season even began.
With the pandemic, the seasonality of viruses has kind of changed. So typically, you might see something called hand, foot, mouth in the summer, RSV in the winter, flu in the winter, and those have all kind of changed more recently.
Dr. Blumenthal says RSV spread much earlier this year. He expects a spike in COVID cases soon, too.
Now that a lot of people aren't wearing masks anymore, should parents be more concerned about their kids getting sick this year?
People's immune system probably took a break during COVID as everyone kind of was masked up and not going out. Now it's kind of coming back a little bit with a vengeance.
If that wasn't enough, there's another virus to be aware of this year, too.
About every other year, enterovirus can cause this ascending paralytic type or weakness type syndrome. And 2022 is one of those years that we're expecting that.
While enterovirus can be alarming in some cases, Dr. Blumenthal says those severe cases are quite rare.
You know, if we're going to live our life, then you're going to be exposed. And so I think part of it is just recognizing that your child will get sick, and that's okay.
Doctors say it's tough to tell which virus your child may have since RSV, COVID, and flu all present similar symptoms like a runny nose, cough, or fever. But some doctors say a sore throat could be an early sign of COVID-19.
I don't think knowing the virus makes a difference about what you're going to do at home for your child.
But sometimes a child will need to go to a hospital, so be on the lookout if your child has difficulty breathing, wheezing, shows signs of dehydration, or has a persistent high fever. Call their doctor. A simple reminder many parents may need after living in a pandemic for 2.5 years.
So hopefully he'll be feeling better soon and sleeping soon.
Dr. Blumenthal says children should also get the flu and COVID vaccine to protect against the most severe symptoms, even though those vaccines aren't perfect. As of now, there is no vaccine for RSV. I'm Lisa Pappas for your local station, Boston 25 News.